Good evening, Bermuda. My name is Aderonka Batamosi Wilson, and I'm the moderator of tonight's vaccine awareness Join the Conversation. My panelists this evening are Dr. Karika Weldon, Government Science Advisor, and ICU RN Claudia Henry, who works at King Edward Memorial Hospital. Tonight, we'll talk about the importance of getting the vaccine and how COVID-19 affects people who are hospitalized. If you're watching on government's Facebook page, there should be you should be able to post your questions below, and we will take your questions and put them to the panelists this evening. We are also joined by Wendy Ingham, who's sign language interpreter for the deaf and hard of hearing. Good evening, Bermuda, and welcome. I'd like to start by talking to Nurse Claudia Henry. Claudia, just tell us a little bit about yourself and your work at King Edward Memorial Hospital.
Good afternoon, Bermuda. My name is Claudia Henry. I'm an ICU nurse here in the intensive care unit at King Edward Memorial Hospital. I've been stationed here for the last 5 years. Prior to that, I've worked in the Bahamas in ICU for 7 years. My work is an ICU nurse in Bermuda. I'm here taking care of critical care patients, patients with life-threatening complications, patients after accidents, and very sick patients.
Thank you.
And COVID-19 patients.
Yes, thank you. Thank you. And Dr. Weldon, we know you, but introduce yourself. Tell us a little bit about your background.
Okay, so good evening, Bermuda. It's good to be back here with you again. I'm Dr. Karika Weldon. I went to university to do medical biochemistry and then went on to do my PhD in biochemistry. And during that 7 year of my training, I was actually doing RNA research. I kind of stumbled into it actually, but I'm glad I did. Because now with an RNA virus and an RNA vaccine, I was well suited and well placed to come back and help my country. And so I've been here as a science advisor and leading the testing lab and obviously getting the vaccine.
Excellent. Well, and I want you both to just tell us a little bit about your work work and experience with COVID-19. Nurse Henry, let's start with you.
Working with COVID-19 patients, I find is not like anything else I've ever encountered. It's a very serious virus. It affects almost every organ in the body. It makes patients very sick. We've had patients with COVID-19 ended up on a ventilator, having them needing dialysis, very sick. It's very much real and life-threatening. And even after getting over COVID, patients are left with a lot of life-changing things that they have to recuperate from. And the road to recovery is long and hard.
Okay. And Dr. Weldon, tell us about your experience.
So I think the main thing is testing. And I think it's interesting to have experience, I would say, the outbreak that we had last month. I think we all kind of didn't see it coming. We had, 5 active cases, and then in a month later, we had like 300 active cases. It was intense. And I think part of that from my perspective is actually doing all of the testing to make sure that one, the people who are positive know as soon as possible so that they can be isolated and their family can be tested and they can be isolated or quarantined, but then also to let the people know who aren't positive with COVID that they are not. And it became very real that people were very much anxious when they knew their result was pending. And so what I will say is that when cases rise and when we have 300 active cases, they all have close contacts that need testing. And now that we have 30 active cases, the testing has subsided and kind of going back to normal. So it's definitely, a real, you see it happen before it happens and you feel it after it's gone type of thing when it comes to testing.
Okay. And let's talk about the vaccine. Have you both taken the vaccine?
Yes, I have gotten vaccinated. I'm scheduled to get my second vaccine next week, Tuesday.
And did you have any kind of reaction to it?
I had a slight discomfort in my arm the first day, just moving my arm, and that was it. I didn't have to take Tylenol for it. It wasn't excruciating. It didn't stop me from going to work and performing my normal duties. And it just went away. I didn't have any other side effects, thankfully.
Okay. And Dr. Walden, you've talked about your experience before. Share with us a little of what your experience was once you got the shot on TV, by the way.
On TV, yeah, I'm thinking about that. That was crazy, crazy move. Yeah, same like Nurse Henry had like a pain in my arm where the shot actually went in. It lasted for a couple days, and probably by Wednesday, Thursday, it had subsided. But I did also have some minor or milder flu-like symptoms on the second day. But just having a good night's sleep, I was able to get over that.
And what do you feel the advantage, and well, actually, before I go to that question about the advantages, Dr. Walden, you've done some additional testing, and
Yeah.
you did some additional testing on TV as well.
Yeah.
What was that? What were you doing? What did you learn?
So I definitely put on my biochemist hat again. I haven't really been using that lately. Obviously, doing testing is a biochemical test, but it's very, routine. You do the same thing every day. This allowed me to go back into that research type mode. I was just personally interested in, can I see the actual tangible, real results of having this vaccine? Prior to getting vaccinated, I had been tested very regularly with the nasopharyngeal swab and also with antibody tests just to make sure that I wasn't exposed and wasn't putting anyone else at risk. And so actually the day of getting vaccinated, I had an antibody test, was still negative. And I think most people, when they get the antibody test, some are looking for having the antibodies, but never really realizing they had COVID. Yeah, I was one of those. Didn't have them. Okay. And so got vaccinated. A week later, I took another antibody test, still negative. And then 2 weeks afterwards, I took the test and now I had IgG antibodies. And for me, it was more about showing that my body has actually done exactly what it was supposed to do. And now I am partially immune to fighting COVID. That I feel better even already having just, seeing those antibodies. And for me, it was really something that I wanted to share with the country because it was a very tangible and real way to show that when you get the vaccine, your body does elicit an immune response that you can actually detect.
Okay, excellent. And so when do you, what for both of you, are the advantages both professionally and personally with getting the vaccine? Dr. Walden.
So I would probably piggyback on what I was saying earlier about the outbreak in December. I think that's when it got really real for me because it became very often that I was hearing from either staff members that they had a household contact who was in contact with someone, or most of the people that were being positive last month were actually in our age group. So some of them were actually friends with some of those who unfortunately contracted the virus and were now themselves a close contact. And it never had become that real until then. And now I had to think, do I want to take the risk of potentially getting the virus, not knowing, as Nurse Henry has said, what are going to be the long-term effects I'm going to have to battle? Or am I going to take this risk? Yes, it's a new vaccine, but surely I'm going to be protected against the virus, and I'm going to also be able to potentially protect others. And that was really in my head weighing that up. And I will say one of my hesitations before was, I'm a young woman, I haven't had children. Is this going to affect me getting pregnant in the future? And when I looked into the research and saw, no, it won't. Just obviously, if you are pregnant for the first 3 months, they're saying probably would avoid that. But other than that, no risk for fertility. Then I felt, there's a no-brainer for me.
Nurse Henry.
For me, it was the fact that day to day I come in contact with patients who are positive, and there is a risk that I have to take in caring for those patients. I wanted to reduce my risk and possibility of ever getting COVID. I know there are a lot of patients that I may encounter that cannot get vaccinated, and I wanted to provide them with a little sense of protection by myself getting vaccinated. And then personally, I have a family. I have a mother who's diabetic. My father's hypertensive. And I wanted to make sure that I could provide them with the surety that I wouldn't bring something home that's going to affect them. So I wanted to take it so that I could provide my patients and family with some kind of protection from the virus.
And so let's talk about the importance of getting both doses. What does that mean? I've got, you go and get the shot, and then you're supposed to get the second shot 21 days later. Why?
So I obviously did take the antibody test, and I have some antibodies against COVID. But I want to probably take us back to a concept that I think we're mostly familiar with, which is the booster shot. Most of us got vaccines, and then maybe it was a few years later, we had to get another dose just to kind of make sure that we had the long-lasting protection. In this case, it's the same concept, but obviously with it being a pandemic, it being a deadly virus, we don't want to wait years before we try to make sure you're fully protected. Most vaccines with the one dose don't have that 95% protection, right? What's normal, I know with the flu vaccine, you're looking at between 40 and 60% each year. I know Johnson & Johnson just came out with a vaccine that is exactly like what we're used to, where we have a dead or weakened version of the virus. That's around 60%. And with this particular Pfizer vaccine, I believe the first dose is around 50% if you just get one. So this is what we're used to, but we can't really take the risk of 50-50, right? And so with these new vaccines for COVID, everyone's trying to get as high as possible. And what they looked at was the booster shot concept. And so if you think of the second shot as just topping up the already created immunity that you would have to make sure it's as high as possible, that's exactly what it's doing. So now I'm going to go on Monday for my second shot. And after 2 weeks after that, I should be up to 95%. And 5% chance of getting COVID is a lot better than 50%.
Mm-hmm. Indeed. Indeed. Nurse Henry, did you want to add to that at all?
I'm not looking forward to another vaccine, but I'm looking forward to more protection.
Okay. That's a great quote, actually. So after somebody has gotten both shots, can they still transmit the virus after they've gotten the shot?
So this has been a very common question, and it should be, because we are all concerned about giving it to the next person. I think part of this disease that has snuck up on us is that you could have no symptoms but still be giving it to people. I know we still don't officially have the data for the Pfizer vaccine, but what is reassuring is that the CEO of Pfizer has encouraged us that there is some encouraging data that they are able to stop transmission. So we're waiting still patiently, but they do have some data that's showing us what, that this vaccine is doing what we would like. So we're just going to wait for the official data. But to hear that it's stopping transmission in animals, which is obviously the first step, that is encouraging. And we would expect that it would do the same in humans.
And so what should people continue to do once they've gotten the vaccine?
Yeah, everything that we've been doing, wearing your mask, socially distancing, washing your hands, or using that hand sanitizer. I think as a country, we should be applauding ourselves every day. We've done a fantastic job with caring about each other and caring about our health by following these guidelines.
And Nurse Henry, what guidance would you give to somebody that that you work with or that you see on a regular basis about what they should continue to do even after they've gotten the vaccine?
Like she said, just do everything you've been taught over the months that we need to do. Wash hands, wear your mask, stay away from work if you're sick, keep the elderly at home. Just do everything that we've been doing. We've been doing a good job. And just continue.
Thank you. And one thing I will add to that and give a plug for the WeHealth Bermuda app. Download the app because we do know that it is how we're using technology to help contain the spread of the virus. So I've got some questions from Facebook. Will someone on immunosuppressant medications get less antibodies after the vaccine?
That's a really good question. I would imagine that they potentially will be affected in some way, but I can't obviously speak to the individual case. I would definitely explore that with your GP just to make sure that it's safe to get the vaccine, and then thereafter that there won't be any complications.
Okay, thank you. Now that we hear of the new variants, i.e. South African, UK, Sweden, etc., are you able to sequence the variants of the virus in Bermuda?
Ooh, I'm excited about this part. So you can see the joy. So I think we've been saying this for a few weeks now. We will be starting to do on-island sequencing of the positive cases that we had. We've kept them for this purpose. In the meantime, we have a great partnership with CARPHA, and we've sent off our first batch to them Monday gone. So we'll know what those particular sequences were. But what's also exciting is that, and this is the beauty of science and the beauty of the diagnostic field and linking with genetics, is actually because we know the sequence of these strains, we can actually design tests to pick just them up. So we can detect those specific strains with a new test that's been created. And this is the same company that was actually the first company to come up with a COVID PCR test. So we're looking to get that. And we should definitely, this in February, be able to know if we have those strains on island or not.
Okay, excellent, thank you. Is overuse of antibiotics making viruses like COVID stronger? If so, should we take antibiotics if we are positive? Dr. Walden, you have any thoughts on that? Or
so I would say antibiotics are for bacteria, to my best knowledge.
Okay.
So if you have a bacterial infection, you take antibiotics, not for viruses. So you correct me if I'm wrong, Nurse Henry.
Right. In the hospital, we don't tend to give antibiotics until we've identified an infection that we're treating with the antibiotics. So we don't typically give antibiotics until the patient has shown sign of bacterial infection. And sometimes you do get bacterial infections along with viruses that have to be treated, but not just for a virus.
Okay, thank you. So I'm just looking at another question. People think that if they don't get the vaccine, they may get the virus and just get over it. What would you say to that, Nurse Henry?
It's not as simple as just getting over a virus. You could get COVID and you could be asymptomatic, but you might just be the person that gets COVID and end up with long-term effects from COVID, and you just won't get over it. You could end up with long-term complications that last for the rest of your life. You could end up dying. You could even end up passing COVID on to somebody else, and they could end up dying. So it's not as simple as just COVID versus the vaccine. I think I would place my bets on the vaccine.
Okay, excellent, thank you. So let's look back, and I asked this question last week, so I'm going to ask you both this question today. Looking back a year ago, at the end of January, what was work like for you then versus the work that you're doing now? And I'm asking you because you're both at very different ends
Mhm.
of the of your view on the coronavirus. And I'll just like to hear your thoughts. Nurse Henry, do you want to start?
Um, well, a year ago, dealing with patients, there was a lot more family involvement. And I think that was very important for patients getting better. Now, when we have patients admitted to the hospital, even those that aren't positive for COVID-19, we technically treat them like they're positive for COVID-19 until we get a sample, a result that says they're not. So we have to isolate them. They can't have visitors. We have to wear masks and all these things when interacting and caring for them. They come in with certain symptoms that might give them the anxieties of believing that, hey, I have COVID, I'm gonna die, something's gonna happen to me. So there's that added anxiety. For us as healthcare professionals too, we have that anxiety added. Okay, I might be catching something now and taking it home. Work is a lot different. It's a much more high stressed in providing care. And I can imagine that it's a lot more stressful for the patient. We've seen difference in the patients. Sometimes, like in the earlier part, there was a lot of elderly patients, and now we're seeing a lot of young people affected. So it's becoming more real that the young population can get COVID and can get very sick from COVID. So it's very much different from it was a year ago.
Okay, thank you. Dr. Walden?
Well, first of all, I wasn't here. Although outside does feel like where I used to live at the moment. I was in Oxford, and I think probably the biggest difference for me in terms of work, I was still doing sequencing at the time, but it was not linked directly to someone's, life-changing result. I was doing more research, a lot more relaxed. I wasn't having to account for results within hours, because now one of the things that, I think Bermuda, we pride ourselves on is that we can turn around results quickly for a tourism aspect. And so that adds another pressure to testing. And yeah, it's totally different, totally different. I used to be able to say, oh, I'll do that tomorrow. Can't do that now. It has to be done today. But yeah, I think that would probably be for me, the biggest change is each and every result is a person and is someone's real life result that they need in order to know if they're safe or if they, need to be isolated. And that's a different perspective to healthcare that I've had now.
Okay. Thank you both for your responses. I'm just looking at another question from Facebook. Does the current Pfizer vaccine protect against all of the various strains, new strains that have been identified?
So I know that the UK strain was probably one of the first of the three, the new ones that was identified. It has been shown to be effective against that. Then you have the South African strain. I believe they were still testing for that, but I think there was promising results. And then you have the Brazilian strain, which seems to have also, they all came at the end of the year. I know that Pfizer, I believe, is taking steps to create another type booster shot that could be taken in order to protect against these other strains. It's kind of the how should I say? It's how it goes. The virus will adapt, and it's trying to survive, right? Survival of the fittest. So it's going to mutate and it's going to change itself in order to survive the longest. So we're just gonna have to kind of be a bit ahead of it and a bit smarter than the virus. But yeah, Pfizer is definitely on it, and I'm happy to hear that.
Mm-hmm.
Just unmute myself. So, and I'm just looking to see what other questions we may have. Are there thoughts or concerns that you want to address from your perspective, maybe questions that people have asked you, either from the science side, Dr. Walden, or from the patient care side, Nurse Henry?
It's just a lot of uncertainty with the vaccine. And like I said earlier, I would just encourage people to try to find out, continue to seek information and find answers to your questions before you just decide you're not going to take it. Just keep trying to find out what you need to find out.
And I know that we've said before that it's better to go ahead and get the vaccine because you know that it does provide high levels of protection for people.
Right.
Yeah, and just to add to that, I think one of the other questions apart from transmission is, well, how long am I going to be protected if I get vaccinated? Because I think some people don't want to get it if they feel like, oh, well, it's not going to protect me that long. I think with COVID actually getting the disease, we seem to have a clearer understanding on how long people actually have the antibodies to fight it off once they've had it. And it seems to be around 3 months. So that's pretty clear. Obviously, we've had people infected for over a year and that data has been gathered. So far with the Pfizer vaccine, people have had the vaccine for most, the highest amount of time is 6 to 7 months. And it's encouraging to hear from the company that those persons still have a very high level of protection. So that's good, because if they had also tapered off at 3 months, then it would be about equal to someone who had COVID. But here we are at least double that time period. And those persons never had to go through the disease, never will have to deal with the long-term effects, but now have double in terms of the length of time protection. And there was also, I believe, some work to show that those who had the vaccine versus those who just got COVID, there was about 20 times more antibodies in your system. So you have more protection for longer without getting the disease. Seems it's a lot better cards to deal with than to try to bet on getting this virus and seeing what happens.
Okay.
Right.
Well, thank you. We're coming to the end of our time together this evening. Do either of you have any final closing words that will encourage people to get the vaccine?
When I was deciding on whether I would take it or not, I heard somebody ask me, have you ever met anybody with polio? Have you ever met anybody with smallpox? And that's really what pushed me to think about it. And I really thought about it. And I was like, all of those vaccines were new. And those persons had to trust the vaccine. And ultimately, it comes down to a matter of trust. And I think you should just try to trust it,
Okay.
that it'll work.
Thank you. Dr. Weldon?
I know that there's a lot of people that are watching us, who have gotten it. And, I rarely get questions each day or texts, oh, how you feeling? How you doing? And so people are just waiting and watching, and that's fine. If that's what you need in order to feel confident to take it, do that. And as Nurse Henry has said, if you're on the fence, don't be so quick to jump and say, oh, I'm not getting it. No. Like, just continue to come to events like this, to ask questions. There are many professionals in Bermuda who are willing to answer those questions. And we want to make sure that it's a conscious decision and one that you are comfortable with. So I echo what Nurse Henry has said, is just keep asking those questions. It's a good thing. It's a healthy thing to make sure that you are confident in what you're putting in your body.
Well, thank you both of you for your time this evening. We've learned a lot about the patient care side and about the science behind the vaccine. So we appreciate your time. And I'm going to encourage you both to stay warm as we battle these winter storms that we're facing right now. Thank you both very much for your time, and good night, Bermuda.
Bye.
Bye.